and I can unmute you guys myself and we can go through it. So we're going to go ahead and get started. We're about 5 minutes in. So ethics and hot topics at interviews. So today we're going to revise the 4 pillars of ethics, and we're going to take a look at some ethics questions, and we're going to discuss a few of the key hot topics with example questions, just so you guys can see how we're going to implement those hot topics, because this is a really, really big part of interviews. So naturally, we hear all the classic things like, the why medicine questions, the role plays, and I think ethics and hot topics are equally as important, a very, very big thing to focus on. So today you guys are very lucky to be here from the group here at the Medic Portal. We are a really great company. We help thousands and thousands of students every year. And we run really popular kind of interview prep things. Like I said, all aspects, so UCAT, mentoring, personal statements, the whole shebang. We help with everything. So, we've got lots of great stuff here, and hopefully today's webinar will be really informative for you guys as well. Oh, that's the other girl, I think, who does it, so I'll skip over that. So, medical ethics. Let's get started. So, the first thing we're going to discuss is the 4 pillars. Now, some of you may be familiar with this and some of you may not. So, the 4 pillars is a really fundamental thing that we do need you guys to know for interviews. And it's something that you guys are going to link into all your ethics-based questions. So the 4 pillars is essentially this concept on what we think medicine should stand on, what medical ethics in particular stands on. So going through what all these terms mean, the first word we have is autonomy. Now, the word autonomy, we regularly might hear it in things like bodily autonomy and things like that. So autonomy means the right to decide what happens to your body and your care. Now, this is a very, very important part of medicine. You guys will know from your SJT and UCAT times that it's very important that a patient is very involved in their care. And the ethics we use to support that is the term autonomy. Now, within autonomy, and I'm not sure if we'll talk about this later, I don't think we do, so I want to bring this up now. Within autonomy, there are 2 key things I need you guys to know about. So in autonomy, there's capacity and consent. So for us to be able to decide whether or not a patient has the right to decide of their body, it seems obvious, and it seems like in every case we should let people decide, it's their body, their right. However, there are a few situations where it actually doesn't apply, and this happens when capacity and consent aren't met. Those criteria aren't met. So consent, as you guys will know or may have heard of, is your ability to agree to something, you giving your permission to something. So if a doctor wanted to take my blood, they would ask me and I would give consent. I would say, yes, it's okay for you to take my blood. Now, for consent, there is a very important thing you guys to know, which is informed consent and the ability to make consent. For me to be able to say yes to something and me to be able to agree to something in medicine, I need to be able to really understand what it is that I'm agreeing with, and do I know all the information, and am I in the right place to make that decision? Am I in the right mental headspace to make that decision? So before consent, we have something called capacity. Now, capacity is my ability to have the right to decide. So autonomy is the right to decide. Capacity is my ability to decide. So with capacity, we need to think, okay, does this person know what's going on? Are they in the right state of mind? So for example, if someone's been in a car accident and they're really shaken up, do they really know what's going on? Are they sure they understand what they are agreeing or disagreeing to? If we have a patient with dementia who has some cognitive problems, do they really understand the pros and cons of this treatment? Do they know what they're saying yes and no to? So do they have the capacity? So if someone has the capacity, then we go forward and we ask for their consent. If they give me consent, I am then able to give the treatment. So very, very important. Now, a little subcategory of consent is these. I know I will speak a lot about a lot of things that may not be on the screen, so do bear with me. And once again, any questions, write them down and we'll look at them together. Within consent, we typically think of adults. When we think of children, we're quite often to think, a parent is the one that makes the decision, which is in most cases true. For all children, there is some kind of level of guardian who is supposed to understand and make decisions for them. However, there are situations where this may not be the case. So for example, the thing I want to talk about is something called Gillick's competence. So that's Gillick's competence. And Gillick's competence is essentially the laws that protect children, so anyone under the age of 18 who wants to make a medical decision. So what we need to think is, do they understand what's going on? What is different about their situation that they think that the person who is supposed to be responsible for them isn't making the right decision? And within that, and the most common example you guys will see is someone under the age of 18 asking for some type of contraception. So that would be a special subcategory of Gillick's competence called Fraser's Guidelines. And that section, so the Fraser's Guidelines is a subcategory of Gillick's that's specific to sexual health. And the common scenario we'll see is, for example, a 14-year-old who's come in and asked for contraception. Should we give it or not? And what we need to think is, do they understand what's going on? Are they in any type of danger? I mean, considering the age of consent is 16, if someone under that is having any type of sexual intercourse, are they aware of what's going on? Are they being groomed? Is there any danger? Are they being abused? Who is the other partner? Is it someone older? Should we be worried? These are things we need to think of. Does the child really know what's going on? And another very key aspect is, if I don't help and give contraception today, is that child in more danger? Are they more likely to go off and have unprotected sex and be at some type of risk? These are the types of things I think about before you give contraception to someone under the age of 18 without their parents' permission. So just to run that back, the key things under autonomy, we have autonomy, which is the right to decide of your body, capacity and consent. So capacity is my ability to decide, and consent is me giving my permission. And then we have Gillick's competence, which is what happens. It's the special guidelines for autonomy and capacity and consent for children. And Fraser's Guideline is a subcategory of that, specifically for sexual health. So that was a lot, I know, but that's kind of what covers autonomy. The next bit we have is non-maleficence. Now, you guys may have heard the term "do no harm," which is exactly what that means, and the more common version of what that is. So we have non-maleficence, which is do no harm, and I'm going to come back to that because I want to discuss that in alongside beneficence. So before I go on to beneficence, we have justice. So justice is the ability to be fair and equal. Are we doing what is right, in the sense of, are we treating everyone the same? How are we allocating resources? Who gets what? And how do we decide who gets what? What is justice? What is fair? Then we have beneficence, and this is the one I want to talk about alongside non-maleficence. So we had non-maleficence, which is do no harm, and beneficence, which is do good. Now, in majority of your ethics questions, you will use these arguments as kind of the pros and cons. And there are a few situations where, it seems like they go hand in hand. I mean, it makes sense. I want to do the right thing and I don't want to cause any harm. But what is good and what is harm? And a very classic example, for example, is euthanasia. So allowing someone to choose to die with dignity and how they want to die. And I mean, we know that killing a patient is naturally doing harm. So we want to say, no, that's not right. It's non-maleficence. We don't want to do harm. And it's not good. However, if a patient is suffering and they've gotten to a point where their quality of life is so poor, am I doing harm by keeping them here? Am I doing the good thing by letting them go? So what is good? What is harm? And that, in a nutshell, is the entire concept of ethics. That's where it all stems from. So these are kind of the 4 pillars, and they're very, very important to learn, guys. I really recommend you know those off by heart, because any ethics question, you want to be referencing these. These are very important. So that kind of covers what the 4 pillars are. So the next bit is the ethical concepts. Now, ethical concepts, there's loads and loads and loads. So it's not like there's a set number that I want you guys to know for your interviews, but the more you read about, and naturally, the more you can kind of relate to. And these are some really good ones here. So consequentialism, that one is in a nutshell where you think about the consequences of something rather than the actual action and whether that makes it morally right or wrong. So for example, a classic one we've seen is, if you tell a lie, but it's to help someone, it's to make someone feel protected. For example, telling a lie to a child and saying, that the fluids in their IV is fairy dust to make them feel better about it. The outcome is the child is more likely to respond to it, and it feels like the right thing to do. So we're focusing on the good bit. But the flip side is something like deontology, where it's, if something, because we know lying is wrong, it's not just, you guys will remember from your UCAN SJT, lying is just a straight no. So do I focus on that? The principle is I am lying, so that's a no. Doesn't matter if the child then becomes comfortable. Doesn't matter if the child ends up in a better place. I think that the actual action is wrong. The other side, another concept we have is utilitarianism. Now, this is a very classic concept. You guys will have most likely heard of the example where there's a train track that splits in two, and one track has one person, the other track has like let's say 100 people. Which one do you choose? And utilitarianism supports the idea that you want to do what causes the greater good, whichever helps more people, that's your priority. So those are a few ethical concepts as well. And you'll come to find that a lot of today might be kind of theory, and a few things you need to know. And much of the interview is about yourself and more about explaining and getting into those nitty gritty things. And there's not a lot of theory, but when there is theory, it's very important you do know that theory. So ethics questions, and how do we go about answering them? Now, this PowerPoint gives a few things, and I'm also going to go ahead and give you guys a few of the kind of the advice that I would give as well. So first of all, don't start with a strong opinion or make a judgment. Now, I completely agree with this. If you go bulldozing ahead saying, you know, I think this is wrong, I think this is right, then you aren't really unpacking the question. There's kind of almost an art to ethics questions, right? So I would say you want to go in and once again, I may revisit this later on when we're talking about ethics, more ethics about the question styles. I personally have this little system that I like to use when it comes to ethics questions, which encompasses a lot of the stuff we teach as well, which is first of all, always start with a sentence, just kind of appreciating the fact that if it's a complex ethics question, that it has many layers to it. I think that really sets the tone for the question. So I always like to say something like, you know, this topic is quite complex, and I understand there's multiple layers to it. Then go ahead and you want to make your ethics argument a little bit equal. You want to kind of consider multiple perspectives. It shows that you're well-rounded. It shows that you're really thinking about the argument before you make a judgment. And before I do that as well, so I say the first sentence about the complexity. Then I go ahead and just say a sentence or two of what your understanding is. So say, for example, my topic is about abortion. I'll normally say something like, understandably, this topic is very complex. It has multiple layers to it. From my understanding, before the ethics, the baseline of abortion is that it's legal in the UK, and there is a maximum limit of 24 weeks before abortion becomes medically required, rather than something that is, something that anyone can get. And then I would go ahead and do a kind of pros and cons argument, speak about the different things. Make sure you reference the relevant 4 pillars. That when they ask you an ethical question, they want you to reference. I mean, it's literally the foundation of medicine. So make sure you're referencing those ethics pillars. And then you go ahead and give your judgment. Now, one thing that I think, and this is, I'm sure, a question that I might get later on, is everyone always gets a little bit nervous about giving a judgment or an opinion. They're like, I don't want to kind of upset the examiner. What if I have a different opinion? But what I like to say is this very, very good little thing that I think is a very easy structure to use is go ahead and give your opinion based on the information that you've used in your argument. But I always like to finish up with a sentence that goes something along the lines of, however, as I learn more about this topic and I read more into it, my opinion is subject to change. That way you're kind of covering yourself. For example, if I talk about abortion, I'm very for abortion. So I might say something like, after my argument, I might say abortion is something that I strongly agree with. However, the more I read about the subject, my opinion is subject to change, and I'm open to learning more and understanding more. This just shows, I think it's a really nice way to end an ethics question. So things you could be asked are things like, does euthanasia have a place in modern medicine? Do you agree with abortion? So do you agree, disagree questions? And then also things about, your real life medical placement. So when would it be appropriate to breach patient confidentiality? So these are kind of a few of the questions that you might get something along the lines of. So ethics at MMIs, in a nutshell, these are the kind of main ways they're going to present. So the first one is a role play. And the role play ones aren't going to be as heavy in content as, for example, like a straight up question. Like, they're not going to give you a role play regarding euthanasia or anything like that. It's more about, they often tie over with professionalism. So it's more about, are you going to do the right thing? Are you going to make sure you don't let someone be dishonest, so and so forth. So for example, a friend is offering answers to an exam questions online. You will need to talk to them about this, those kind of things. We have discussing with the examiners. So it might be something like this. So it's kind of like a role play without the actor. They're basically going to give you a scenario and you say what you would do. And then you might have a discussion with the examiner, the other side, which is your classic, like, do you agree or disagree? Discuss this with your examiner, so and so forth. So these are the classic styles of ethics at MMIs we see. So ethics hot topics. Now, aside from this page, the Medic Portal has a really excellent page for NHS hot topics that I absolutely adore. So when you guys are free, or like after this PowerPoint, if you guys search up the Medic Portal NHS hot topics, it is just my absolute go-to. It has everything. It has like all these little sections that you can kind of click on. It takes you to the page, got all your information. It's very up to date. I really love that page. So I highly recommend, if you guys want to know about the hot topics in particular, aside from what we kind of talk about today, that is definitely my go-to one. Now, in terms of the key hot topics that especially we see quite as a common theme recently, AI, big one. I mean, I've at least had one or two schools ask about AI, especially over the last 2-3 years. So especially the last 2 years I've been doing this, I've heard at least one AI question. Strike action is very likely to come along, possibly, considering especially, we've had so much strike action and we have more strike action pending. Medical cannabis is a very classic one that, it's kind of one of those timeless topics that we will go back and forth on for a very long time. Of course, the classics of abortion, euthanasia. Organ donation is a really big one because, there's never a right answer for organ donation. So it's such a timeless question as well, because no matter what the laws and guidelines we have, there will never be a right way to answer organ donation or kind of who gets the donation, so and so forth. We also have specific cases like the Bawa Garba case. Now, it really depends, because I also, understandably, I haven't really heard universities give specific cases, just because it's a little unfair, just in case someone hasn't heard about it. But it is also up to you guys to make sure you're up to date and staying in touch with what's going on. So for example, the Shropshire maternity scandal, those types of things are very important to know about what's going on. There's also lots of other cases. I mean, we'll come across it later on as well, but kind of racism in the NHS, especially recently, considering the kind of the movements we've had recently and the kind of frustration across the country about immigration. Racism is currently reaching up to an all-time high again, which is very sad and very unfortunate and very upsetting to see, and unfortunately something that we've really been experiencing recently. But it's definitely a hot topic that is coming back up, so I really recommend you guys are up to date on that as well. So we're going to go into some of the hot topics as well. We're actually going to discuss some today and kind of talk about some key questions, and hopefully we'll get a bit of an understanding from that as well. So the NHS crisis, now this is a big one. This has been going on for years and years, and unfortunately the NHS is really struggling and crumbling right now, and it's naturally not the best thing to hear, considering you guys are looking into joining the NHS. However, we, of course, it's the reality of it, and it's something that we need to be honest and open about. So and speaking of honest and open about it, when they ask you questions about NHS crisis or doctor strikes or things that may seem like the examiner might be a little bit more involved in or is a little bit closer to home, I think it is good to just, you've got to take on the chin and say it how it is. I think sometimes, we've had situations where I've done questions with students, and for example, we're talking about the doctor strike, and they'll kind of like shy away from being kind of upfront about it. But that's not what we want. We understand there's negatives. We understand that this is the reality of what's going on. What we're looking for is how you justify, how you explain, what are the ethics you're using to really demonstrate that. That's what we want you guys to be involved in. So don't shy away from topics that may feel controversial. Naturally be respectful of it, but don't shy away from it, because we understand that that is the reality and the gravity of the situation. So NHS crisis. So things you should be able to discuss about, the backlog in the NHS, cause and consequence, very, very big one. So if we're thinking about causes, the biggest one people always go with, and rightfully so, is the COVID times. We've had such a backlog from there. I would definitely look into kind of some stats and things like that. And another thing I want to put out there is it's not essential that you guys know like 101 statistics and 101 facts that are very specific. I think one or two general statistics that can be applied apply to multiple things are very useful. Like, for example, just the number of beds, the number of patients that didn't get a surgery in COVID times, that would be you'd be able to talk about a lot of things from that. And I think about the consequences of those. We have ambulance response times, so missed ambulance response times. Now, this is a very big topic because the ambulance system is really struggling right now. I mean, it's very unfortunate, but it's very, very real. And it's unfortunately something that a lot of us medics see firsthand when we're not in a hospital environment. And it can be quite unfortunate. We need to think about, what can we change? What can we do different? But as well as that, when they ask you guys about what's going on, what can we change, you've got to be realistic about it as well. We can't magically fund new ambulances. We can't magically buy new ones. We can't magically have more paramedics. That's just not the reality of it. So what can we do realistically? What is the problem and how can we actually make a change is what you guys need to think about. And the next one is the recruitment crisis in social care. I mean, this is a very big one as well. I don't think people are fully aware of just how many amazing healthcare roles there are. I think people are very quick to just go, okay, well, we're going to look at the ones that we see on the front line. So doctor, nurse, and less likely people would then go into like physiotherapy, pharmacy, things like that. But there's so many incredible healthcare roles and social care roles that we just don't know about. And I think that, definitely education and improvement of that is such a big one to look into. So some key questions we've seen is, and this is what I was talking about, so how would you improve the state of the NHS if you had no money to spend? And they love asking things like this because when we ask you guys, what can we do different? How can we save this crisis? People are like, spend more money, get more funding, but it's just not realistic. So we need to think about what can we actually do and how can we go about it? And the next one, so to what extent do you think the junior doctor strike was justified? And this is also a form of ethical question because you need to think about, and always relate it back to your 4 pillars. I mean, was it doing harm? Was it doing good? Is it fair to the junior doctors? Should they sacrifice their lives and mental health because of their doctor role? Is that justice? And autonomy, I mean, shouldn't they have a choice over what they want to do with their bodies, what they want to do with their lives? Those kind of things is how we relate back to our ethic pillars. Another one is of A&E waiting times, ambulance delays, cancer treatment backlogs, which you think is the most urgent to solve. Now, this is a little bit of a harder one, but what I always say is there is no right, and I will say this a lot, and people will always kind of ignore it, unfortunately, but it is the truth. There is no right or wrong answer when it comes to prioritizing or choosing something. If there was a right or wrong answer, we would be doing that right now. We would say, okay, ambulance delays get priority over cancer treatment, so and so, and it would be in the news and it would be the reality. If it's something that's using real life scenarios but doesn't have a current solution, naturally it just means there isn't a realistic solution. So it's more about how do you justify and what information do you know that you can put in. As long as you can justify and stand strong in your reasoning as to what's important, that's all we're looking for. So here's some, and this is, you're very welcome to kind of make a note of this. So here's some really key facts and figures that are really good to know. So you guys don't need to go ahead and have a look. So a very interesting to know is that ambulance response times, they fall in categories. So you think about what type of condition it is and then how long you have it. But unfortunately, we are not hitting these target times. And I say this, for example, so like I said, I'm a final year medic and we've just had our GP block where we run our own consultations. And actually, the very first patient I saw was a medical emergency. We had to send her away in a hospital. Send her away in an ambulance to the hospital. And she was in severe pain. I would put her in number 1 or 2 in terms of her condition and how bad it was. But unfortunately, I was waiting with her for about half an hour to 40 minutes for an ambulance, which is very unfortunate because she was, it was very much a few hours make or break for her current situation. She was in a lot of pain and was in a very serious situation. And it's quite upsetting to see because especially when you know someone's in pain, you can't do much in a GP setting. But unfortunately, we're just not hitting those ambulance target times. So we have to really investigate what's going on. How can we change this? What is going to make that change? So we have a little graph here as well for you guys to see about the response times as well. Okay. So some more kind of statistics that are really good to know as well. So waiting times, waiting times are unfortunately ridiculous. So 7.4 million people are waiting for a consultant-led elective care. That is up from the 4.4. So we are like almost 3 million up or whatever it may be. 39% of those are waiting longer than 18 weeks to be seen, 17% pre-pandemic, and a long way from the 8% target. I mean, 39% compared to an 8% target, we're a very, very far off amount from that. 4% are waiting longer than a year. And, some other good things to look at, the NHS waiting times, unfortunately, when we're thinking about waiting times and how to improve that, we have to think about what is being sacrificed and what are the consequences because because we have these waiting times. If someone is waiting so long for care, by the time they get there, they're significantly worse. So, how much care and how much good care can we give at that point? If we can treat something earlier, we're going to have a better way of treating it compared to later on, where it's much more dangerous. So, waiting times are doubling up or tripling up or whatever it may be. But so is the condition of the patient, and which is then in turn meaning more treatment, in turn more money, and it's just a continuous cycle. It's a kind of a domino effect that we need to consider as well. So, and looking at social care. So, social care was supposed to be a way of reducing pressure on NHS by allowing people to be treated outside of a hospital. But unfortunately, we just don't have the people working in it. And I think one of the solutions that I hear a lot when I do this interview question is, we can hire more people, we can recruit more people. But I want you guys to ask yourselves before I started this, I'm not sure how many people are in the meeting now, but there was 150 of you guys in the meeting. How many of you guys actually know what social care is and what that job role is, and what degree do you guys need, and then how do you secure that job? And majority of you won't be able to tell me. And I myself wasn't aware of what social care was until I was doing these interviews. So we can't just say we're going to get more people if we don't even know what the job role is. We don't know how to advertise it to people, and we're not sure where to go about it. So maybe it's not so much about just grabbing people out of thin air and making them go into social care. It's more about, how are we going to advertise it? How are we going to demonstrate this is a good role to have? If you guys think about, I'm not sure if you guys have seen this, but it was a very, very good advert from, I think it was Canada and America. I think it was the Canada to America, where Canada was kind of low on nurses. So they did an advert in America and was kind of influencing American nurses to go over to Canada. And, that's how, and it worked, apparently. The numbers did go up. So that kind of thing is what we could look at. So the vacancy rate nearly doubled post-pandemic, and we now heavily reliant on immigration to fill key roles. However, as you guys know, everything is a domino effect when it comes to ethics and these hot topics. We rely on immigration to fill these key roles, but when they're not made welcome here, and we have these kind of the crisis that we have going on right now, and we make people feel not comfortable, and we say that we don't want anyone else supposedly coming into our country or whatever it may be that they're saying, it's going to have consequences on the roles that they are filling. So everything seems to have a domino effect, and we need to remember that. And this is why NHS Hot Topics is also such a great topic, because not only is it interesting for you guys to learn and know about, it's very relevant to your future careers, but when you're discussing it in questions, you have to understand that there's no simple answer for any of these ethic questions. It's almost like you're debating yourself. So it's about whether you can see both sides of the coin, and whether you can truly what your perception of this is. So fit for the future, that's another topic. And this is the 10-year health plan for England that it was published in July 2025. So these are a few of the key points. So from hospital to community, there's more care in the community. So we're trying to ease the burden on hospitals. Moving systems online, so NHS App. Any of you guys who have had to book a GP appointment recently will unfortunately know the struggles of having to use their online appointment services, which can be quite frustrating, because we used to just call the receptionist and they'd book us in, but a lot of practices have moved such that you need to use a link and you need to go in through there. And a very important one, so improving emphasis on prevention rather than cure. Prevention will always be more important than the cure. So looking at this though, so we have these goals that they've set, but if we have a look, the NHS budget increased by 2.8%. That is below historic funding levels. We want to do more in NHS, but with less resources, which doesn't really make sense. And more care in the community and more emphasis on prevention is all good, but will not save money. You need money to do these things, but it's going to take time to get there. So similarly, using tech to develop new drugs is great, But new drugs are expensive, and technology is one of the main drivers of NHS spend. It is not saving. We want to do all these new things to save money in the future, but we don't have the money now. So this may save more lives, but saving lives cost money. So one thing that I do warn you guys when you are doing your ethics questions, avoid trying to say more funding or using other funding or reallocating funding. That is unfortunately just not a realistic solution. And for those of you who do read up and do understand this, that's when we know you know your stuff, because we know that we can't just say that and get away with it. Okay, so vaccinations and NHS. Now, this is another very big topic, very, very good topic, and a very classic topic. So, these are things we want you to be prepared to discuss. The development of the COVID-19 vaccines. So we had multiple people developing COVID-19 vaccines, and it happened very quickly, but how much do we really know? What are the consequences? And a lot of you guys will have seen, the backlash from people who are against vaccination and their justification in that. So we need to think about that. We need to think about, how do vaccines work? So we've got different types. We have live vaccines, where they have a very weak version of the virus or whatever it may be. That will then, your body will fight it, but it's too weak to do anything to you. Or you might have a dead version of the virus, which then goes in and your body will still attack it the same. And we want to think about which vaccines are currently offered on the NHS. So which do we get, which do we not get? And then very big on the anti-vaccine movement. Now, this is unfortunately something that we do battle a lot, and it's very much, it fluctuates. Sometimes the pro-vaccine people are winning and sometimes the anti-vaxxers are winning. So unfortunately, it's one of those things that we're just going to have to be in a cycle for pretty much ever. There's no really easy way to defeat it, because if we go all the way back to our ethics and our 4 pillars, everyone's got autonomy. You have the right to decide what happens to your body. Vaccination is not compulsory, so we can't tell you what to do. And we want to do good, but what is good to us and what is good to the person that's deciding the vaccine? And maybe it's harmful to them when it may not be harmful to us. And then we might want to think about the MMR scandal, which is a very big topic I highly recommend you guys read about. So some of the key questions you might get is, why is measles on the rise? I mean, we're seeing some really kind of frustrating information where, understandably, parents are very concerned about their children, and rightfully so. You're a parent, it's your job to be concerned about your child. But with the kind of lack of understanding and some of the false propaganda going around, the lack of vaccinations is on the rise. And another very good question is vaccinating children ethical? And just so I can demonstrate to you guys what I want to see you guys do in your interviews, we want to think about that back and forth. So is vaccinating ethical? I would always try and use your ethical pillars, and using that structure I tell you guys. So I would answer something like, understandably, this is a topic which has a lot of levels to it, and it can be quite complex. Currently, vaccinating children is under the guidance of parents or their guardian, and it is completely moral and legal as of right now in the UK. And then I would do some back and forth, and definitely use your ethical pillars. So autonomy, it's not the child deciding, it's the parent deciding. And so who's really got autonomy? But then I've got my Gillick's competence. Should a child be able to decide whether or not they want it? But then, it's doing good for them, of course, but at the same time, they've got to go through the trauma with the vaccine. And it may seem a little bit funny to think of it as trauma with the vaccine, but you'd be surprised as to the number of children who come out with very strong reactions to getting a needle put in them. Like, it's much more surprising than you think. I know a lot of situations where, because their children don't really understand what's going on, they develop a fear of doctors and hospitals because they associate it with jabs. But naturally, we don't have a choice, but we have to give them the jab if they're asked for it. But then it means they don't trust hospitals. So, it actually does have consequences. And then I would think about, is it justice? I mean, if I let some children not have the vaccine, but I make other children have it, and, these children have to go through it to protect others, is that me treating everyone fair and equal? Is that justice? So that's how I want you guys to start thinking about those ethical scenarios and those hot topics. So this is the next category. And like I said, this is very much a big, big hot topic that I really want you guys to know about. And this is not just in terms of interviews. I think this is very, very prevalent in our current NHS system and in our healthcare. And you'd be surprised as to, you know, naturally we've seen on the news all the protest and anti-immigration things, but when you see the impact it has on a lot of the medical staff here, it's really upsetting to see it, honestly. And you know, I myself, so like I mentioned before, I'm a final year medic, and we've even had incidents at our placement where unfortunately a few of my peers have been victims of racial abuse, and it's because of the high rise. And that's just, you know, it happens anywhere and everywhere, but we do need to know how we're going to protect people, what are we going to allow, what are we not going to allow. So be prepared to discuss inequalities faced by NHS staff. So whether that be racial inequalities, or whether that be, you know, gender-based inequalities, or you know, not just doctors. I mean, we have a current debate as well, which is a little bit of a side one, not so much BAME related, but especially inequality, is we have physician associates, and you know, they do such an incredible job, but it can be it's a very controversial topic about what their role is. And you know, sometimes they may not be treated to the right respect that they deserve compared to other members of staff. So, and you know, nurses versus other members of staff, unfortunately nurses have been through quite a lot, and they deserve all the respect in the world. I mean, nurses are just some of the most incredible people you will meet, and they are absolutely the backbone of the NHS and all medical services. But unfortunately, they're not always treated with the same respect they deserve, and that's unfortunately an inequality they face. With inequalities in BAME patients as well, this is a very big one. You know, there have been multiple studies and research gone into this. Women, so for example, if I'm looking in the maternity unit, it was several years back, but a study was released where a woman of color was they had significantly lower levels of healthcare in comparison to someone who isn't a person of color, because of just such embedded inequalities and those kind of thoughts. And it's very unfortunate, but it's very, very real. The science and the statistics demonstrate it, and we really have to fight against that. That's, you know, we want you guys to know about this. We want you guys to be so passionate and educated about this when you guys go into interviews, because you guys are the people that are going to make the change. When you go into medical school or whatever it is that you guys do, you know, you guys are the ones that are going to be the ones that stand up to this. You know, being a bystander is just as bad as being the perpetrator. So we want you guys to know how to handle this, to know those inequalities, and to be able to say, like, you know what, I won't stand for that. And we have many situations in terms of BAME patients suffering. So, you know, for those who may not be fluent English speakers, we do have translation services, but unfortunately, they are shockingly poor. So a lot of people, for example, GP practices may not have the best versions of those. And even if you do have a translation service, it's online and sometimes a little bit hard to correlate. It can be very, very difficult. So when you think about those inequalities, we want to think about how COVID-19 impacted BAME communities differently. So, you know, and this comes more from cultural backgrounds and maybe what their understandings are of COVID. And what is the NHS doing to try and address these inequalities? Very important as well. So some key questions, you know, how has COVID-19 impacted? What are some of the barriers to equality of healthcare outcomes? So lots of research and studies into that. And I've actually just seen, I think it was either today or yesterday, literally just an article just came out saying racism is now back on the rise towards NHS staff because of the recent events. You know, we were doing so well, but unfortunately, the public, a few members of the public are unfortunately behaving in ways that are just really cruel to members of staff. That is on the rise. That is something we need to be wary of. And this isn't just obviously NHS based. I'm only saying that because this is a medical interview one, but it's happening across all fields and departments. It's very important for us to know about. So what are some of the challenges faced by BAME working in the NHS, and what can they do to address it? So that's very good to know as well. These are definitely things I want you guys to look into. So these are a few more hot topics. And like I said, we have a really incredible website. Please do just search up NHS Hot Topics, the Medic Portal. It will take you straight to the page, and it will have all of these as well. So, and it will have like, for each of these topics, it will literally have a link which takes you to a page which tells you about all the statistics and like all the information you guys know. So definitely recommend you guys look into that. So That kind of brings me to the end of today's PowerPoint. We have lots of great things that we can offer you guys. So we've got lots of free guides, blogs, and webinars. I think there's another webinar that I'm doing as well. So this is a 3-part webinar. I did last week's, this week's, and I'll be doing next week's as well. We have kind of interview strategy. We've got day courses. We have really great, the MMI experience. It's like a circuit where, I work those as well, and it's really great. We have such great examiners come in, and we kind of do a circuit where you stimulate the environment and you go around, you get feedback. It's very, very good. We have online one-to-one marks. We also have kind of boot camps and tutoring. So, if you are looking for any extra support, we do offer these really great services. So I highly recommend just having a look. Okay. Oh, and you guys get a discount code. How exciting. So you're very welcome to take a picture of this discount code. I'm sure it will be sent to you guys as well. But yes, do use the discount code for 10% off. Okay. So that does bring me to the end of this one. But like I said, we're going to do questions now. So let me come back to this. Okay, so very, very well done for sitting through that. I know it was a lot of talking. Oh, I was frozen there. Okay, so I can see a few questions coming into the chat, so I'm going to just go through those. So let's have a look. Okay, so the first question I can see, so thank you for your question, Lucy. Will the presentation on the 23rd October that could not go ahead be rescheduled? Great question. I am going to have my TMP fellow member, is that going to be rescheduled?
Not sure. No, that was rescheduled for last week. We did, yes, it was the week before last, I believe. They sent out a new email with the details from you last week that you did. Yes. It was
okay. Okay, so one last week was that the replacement.
Yes,
thank you so much.
It was the replacement because that was not due. That was in replacement to the technical issues that happened the week before. Yeah.
Okay, I see. Got it. Okay, thank you. So next one is Rebecca. So in ethical questions, do we actually state the pillars? Like, I will approach this using the ethical pillars first, autonomy, such and such. Such a great question. I think it's kind of, you don't want it to make it robotic, being like, I am going to speak about autonomy, but you can be like, you can definitely use that approach, but I think always try to integrate it. So I like to use a system of kind of talking about, well, someone has to have a right to their body, which is one of the ethical pillars, autonomy, and then kind of going from there. So rather than saying the pillar and describing it, describe it using the situation and then say the pillar, but you can kind of do it back and forth as long as it's not something like, and then there is autonomy. Autonomy is important. That's when it feels a bit like you're saying a ping word on purpose. Okay. Can I go over deontology? So deontology, let me kind of, I would recommend that you guys read up on those things as well. So deontology, in a nutshell, it's essentially where you're focusing on the actual action rather than consequence. So for example, if I'm using the concept of, let me think of something that maybe, if, for example, I'm going to go with a lying situation, but say you had to lie to someone, the child, about the vaccine, that it's not going to, the fairy dust in their bag or something. Deontology is where like you focus on the actual principle, and the moral aspect comes from your action. That has to be in the right department all along. It doesn't matter if the outcome is good or outcome is bad. We're focusing on what the right thing to do is in the action. Where did you say we can share the hot topics? So the hot topics, just to be very clear, it's the Medic portal, NHS hot topics. If you search that up, you'll get straight to that page. Will we have access to the PowerPoint? This is a question I'm going to have to pass over to my colleague. Will they?
Yes. This will be sent out to you by Wednesday next week. And hopefully a recording as well will be sent out to you by Wednesday next week as well.
Okay, brilliant. Thank you so much. Are your figures on waiting times each UK based or England only? I'm living in Scotland. I think they were UK based, but this should be on the hot topics page. Have a look, but if not, just have a quick Google about whether if you want Scotland specific or England specific. What is BAME? So BAME is, let me actually get up the full name. I'm not sure if we have. So I think BAME is so I'm right. So it's Black, Asian, and minority ethnic. So that is essentially for categories of people typically outside of Caucasian ethnicity. So Black, Asian, and minority ethnic groups. In an ethnic question, would you bring up politics as a factor? You most definitely can. If it's something that influences it, you definitely can. politics influences a lot. I mean, if we think about doctor strikes, and we think about in a lot of the political stances where they're kind of like, we don't want to give you that pay raise, but we want to keep going with inflation, and we still want to do such and such. Politics does play a role. They're the people that decide our pay raise. So definitely you can bring up politics. Do you do group interview practice? We do courses as a group, and we do the MMI circuits as a group. So they do in that MMI circuit, you'll be put in a pair with someone else, and you guys will take turns doing 10 stations each. So you do a total of 20, you do 10 and watch 10. So that would be kind of our version of the group one. Are your courses useful for dentistry interview? Also, 100%. These are all dentistry follows the exact same ethical principles and a lot of the exact same ethics. The only thing is maybe a few of them might be more medical related. There might be some slightly different dentistry hot topics, but if you just search up dentistry hot topics interviews, you will get those 100%, so you don't have to worry about that. But the actual, like the 4 ethical pillars and those concepts, very, very relevant. How many ethics questions could you be asked? Typically 1. Maybe 2 if they do a role play. It's going to be 1 or 2 because they want, if it's MMI, they want to do a different category per one. So ethics will normally be just 1 station. They're not going to ask you like 4 or 5. It's going to be 1, maybe 2 if you have a role play, because the role play where you have to kind of tell your friend not to cheat, that crosses over into professionalism as well. So they might say it's professionalism, but it's got just a few bits of ethics to it. But ethics is kind of the core of a lot of things. Our final judgment is always necessary. Not always necessary, but I think it's good to give to an extent, because if the question, we like people to answer the question. If the question asks you, what do you think, or what is your opinion, you want to give an opinion. If your opinion is genuinely neutral, you might say, as of right now, my opinion is neutral, as I've been unable to find information that has swayed me towards one side. So if that's your honest opinion, that's fine. But if you are also very pro something, go ahead and say that. What should we know about immigration in the UK today? Always keep it very medical, but I think it's very important to know. I think the main thing is about tension rising in the UK about immigration and how that's impacted the NHS services. And also about, we have a large chunk of our NHS services are based on wonderful immigrant workers, absolutely incredible people. Very important that we give them the credit. And what happens if we do take away immigration? What if we do tell people that they can't be here? What's going to happen to NHS? It's going to collapse. That's very much the reality that NHS will collapse. So we have to kind of, those are things I would think about in terms of immigration in the UK. You're most welcome, Lily Grace. I did not I'm very sorry to the person who didn't receive the email for the rescheduled session. If you go ahead and pop an email, I think, will they be able to get the recording maybe?
Yeah, I can ask. If you email info@themedicportal.co.uk, they will be able to assist you with that.
Wonderful, thank you. How much data are we supposed to quote in our our answers? You don't need to quote data for every single thing. I think maybe having 1 or 2 statistics, and if you're able to use a statistic, that is great, but maybe just 1, 2 max in your answer. The main thing is your justification, not the amount of facts you can regurgitate. So don't worry about knowing every single thing in the world. Many of your answers maybe won't even have a statistic if you don't have one. That doesn't matter. If you do have a statistic, I maybe think 1 or 2 maximum is all you need. My skin is glowing, thank you so much. How much do we elaborate on things like Gillick's competence? It depends on the question. So if you're how do we elaborate on things? All you really say for Gillick's competence is quite literally, I think, once again, great page on our MedicPortal website about it. But in a nutshell, it's just about knowing whether the child understands what they're agreeing to or disagreeing to, and whether or not we would say, I think it's not so much expanding, because you don't need to know the ends of word. It's more the gist of it, such that it's outside of, if you're under 18. But actually, very important thing about Gillick's competence in terms of elaboration is, the one thing you guys do need to know is the little subcategory of Fraser's guidelines. It's for sexual health is for under 18s, but I think it's over 12s. Double check me, it's either 12 or 13. anything under the age of 12 in terms of any type of sexual intercourse or anything like that is completely illegal. Under 12s cannot be doing, even if it's with a fellow 12-year-old, whatever it may be, it's completely unacceptable. That's the kind of things. But in terms of elaboration, it's just more understanding the fact that there is a law that protects them as long as they follow the guidelines and the rules they have for Gillick's competence. It doesn't matter if you deviate from the answer structure that I've given. This is just something that I personally use and I think is quite helpful for a lot of people. It's what I recommend people use, but 100% feel free to deviate from it. Do whatever works best for you, as long as you are using your ethical pillars and you are making structured points and you are giving a conclusion. That's what matters. So thank you so much for your presentation. You're welcome. I noticed that we have to know so much for interviews. How long do you think we should prepare for them? I think definitely starting out little but frequent is better than one short burst. The thing about interviews, I know it feels like a lot to know about, but as long as you're reading maybe like 1 or 2 hot topics per week, you're sorted. Just know about the main ones like AI, the strikes, the wait times, all those classics, and everything else kind of comes secondary to that. But the main thing about interview prep is building confidence and being able to speak. You guys will be surprised. And I remember from my interview time as well, when you actually have to sit there and have the discussion with someone out loud, words fly out the window, your brain goes all haywire. So I think at least once a week, just sit down, whether it be family, friends, whatever it is, just sit down and do kind of like a mini mock interview, or just daily if you can. Just have one of your friends ask you an interview question. That's how I'd go about doing it. It's not so much how long you do it for, it's about how consistently you do it. So you mentioned Fraser guidelines and gave a scenario of a child underage wanting contraceptives and said, would giving them do more harm or not? What is your stance on this? Because they are under the age of consent. If you don't give it to them, it could do so much more harm. Very good question, Yusuf. Thank you. So in terms, because following the guidelines, it depends on the harm. If I feel like they're in a dangerous position and me giving contraception isn't so much protecting them, it's just a short-term solution, maybe I need to refer to a different set of authority. But if I feel like this child understands what sex is and they know they're doing it in a safe environment, like say they're a 15-year-old who knows and understands, but they're going to be in danger of having unprotected sex, for example, which can then lead them to being in dangerous positions, then I would go ahead and give it because they are fully understanding of what's going on. They know their pros and cons. And the only risk they have is that if I don't give contraception, it can lead to more detrimental outcomes to them. So I would go ahead and give it because they've fulfilled the other terms of the criteria. Will it negatively impact you if you have a strong opinion on something? Not necessarily. I think naturally you have to tread lightly with everything and be respectful. So for example, if it was abortion, like I said, I'm pro-abortion, but that doesn't mean in my interview I'm like, this is the only way and this is right. I would say, from my understanding and my experiences and what I've been fortunate to be educated on, I agree with abortion, as I think that the pros definitely outweigh the cons. So it's more you say you can agree with something, but it's not like a this is the highway or no way. It's more of a this is my opinion and this is my justification. However, naturally, I'm always open to learning and understanding. I will come back to the question about Southampton. Would you recommend reading a short introduction to medical ethics or a similar literature? 100%. I think the more you read, the more you know, the more you learn. Always a big advocate for read whatever you need to read, but don't feel like that you have to read every book and the word is law. It's more read what you can. The more you read, the more educated you will be, the more informed your answers will be. But yeah, I definitely recommend go ahead and have a look at that introduction. Can I be emailed a video presentation for last week's? Same thing. So if you go ahead and send an email, we'll see if we can do that. Regarding the topic of vaccinations, could we talk more about how much more attention needs to be put on informing the population about vaccines and debunking misinformation? 100%. This is a very important thing. Like we said, there's nothing preventative is just as important as cure. So education is a very key aspect of vaccination control. How should we go about practicing questions? Such a big advocate for friends and family. And I also really recommend recording yourself, because you don't realize what you look like when you give an interview answer until you've recorded yourself and you're like, I was fidgeting and I was looking here and there. And a very classic thing, I was such a big victim of this, is you'll realize you say things like, things like that, which is very like informal language we don't want to use in interviews. Highly recommend record yourself and have a look at your recordings. Do it with friends and families. And a really good one that I thought of kind of recommend students, one I tell them at schools as well, is if you have a drama class or a drama lesson, or whatever it is, a drama department in your school, just ask them, can the students, do they have like a drama lunch club? Would maybe they be willing to do one of their lunch clubs to do role play scenarios? Because who's going to do it better than people training to be actors or people interested in drama? So I think utilize your resources. Anyone and everyone can do it, but as long as you are reflecting on what you're looking and learning on. In the role play, is there an actor and an examiner in the interview? So the actor is not scoring you. Also, if it's delivering bad news, do you get a private room? All MMIs are done in their own separate little rooms, so you always have a private room for all of them. And yes, it's an examiner and an actor in the room. Examiner won't say a single word to you. They'll be the one storing the side. The actor's just sat there doing the acting. How do you avoid sounding repetitive when answering ethics questions? I always say, make 3 clear bullet points in your head before you go ahead and answer the question, and just go into each of those bullet points rather than letting yourself freestyle it a little bit. That way you avoid repetition. You've got your clear structure about what's going on. How many stations will be role play or ethical questions? You'll only get, like, if it's ethics, there'll be 1 ethics question station. If it's role play, there'll be 1 role play. You might get an ethics and a role play, so you might get 2, but that's the maximum. It's each MMI station tests a different category. As someone who's in year 12, what should I be doing right now? UCAT practice work experience. So if you're in year 12, I definitely recommend just kind of work experience, volunteering, extracurriculars, just your general things and your academics, obviously. Don't worry about UCAT until the season approaches. That's not something to worry about until kind of the summer season. Those are the main things. So kind of just building your understanding and then definitely just getting as much understanding and knowledge of medicine. So work experience is such a big one I recommend. What's the best way to ensure you're fully prepared for any question? I think the best way to ensure you're fully prepared for any question is not to have 100 different responses for 100 different questions, but to have a more generalized kind of reasoning and things. So, for example, aging population is one that's a category. I could talk about aging population affected in COVID. Aging population affects ambulance wait times because they often have the most comorbidities and they cannot get to ambulance by themselves. Aging population can often also be very big in kind of the healthcare inequalities because they're such a big sector, so on and so forth. So I would look at categories that are more broad, focus on those, and then go into niche things. That way you're prepared for any question because you can utilize it into anything. But also, for example, like knowing your ethical pillars, you can put ethical pillars into anything. So knowing your base foundation really helps set the tone. Once again, so for the recording of the 23rd of October, if you go ahead and give them an email, they might be able to get it to you. Will the interviewers judge my English fluency, or are they only going to judge my logic and problem solving? 100% only on logic and problem solving. They should not judge any of your English skills whatsoever. If you feel like you are being judged for your English skills, I would definitely make a note of that, and that should be escalated. They never ever judge that. That's not their place to judge that at all. So don't worry about that. How long would you typically talk for an ethics question? Depends on how long you get in the station. So each interview is different. If it's like 5 minutes, you can talk for 5 minutes. Maybe you'll only talk for 3. Maybe there'll be a follow-up question. Normally they'll clarify, or you can go ahead and ask, is there a follow-up question? Because then you'd have to talk for less. But if it's just that one question, go ahead and try and talk for the 5. Is it useful if studying outside the UK, or do I have to do more research? So a lot of the base principles are useful for outside of the UK, but in terms of the hot topics, these are only UK hot topic based. So I'd recommend, if you're looking for outside of UK, have a look at what's relevant to that country. Are there any recommended sentence starters or types when answering scenario questions? For scenario questions, if you're talking about ethical scenarios, like I said, I always recommend starting with something like, I understand the complexity of the issue, and then giving 1 or 2 sentences maximum about what I do know, like factually about the situation. If it's a scenario as in like the scenario of like the elderly man walking out with a nightgown, I would always start by trying to understand the situation more and talking about what are the key things I'm looking for and what are the things I don't know before I go ahead and do my explanation. What is the role of physician associate? It's a very good question that I am not particularly sure of myself. I think it changes a lot. Physician associate is supposed to be kind of a support to a doctor. However, this is the issue. The debate is, I don't think a lot of people are aware of the role of physician associate. This is something I myself will have to look up. So I recommend kind of maybe Googling a little bit. I think there should be probably an NHS page on it, but that I think is the main issue. I think it's very difficult to kind of differentiate the role of a physician associate. Edinburgh has a group task. How do you help with that? Yes, I think I've heard of this. If there's a group task, just kind of think about, they're kind of testing your teamwork and are you able to work in a group. So think about what teamwork skills you need and make sure to implement them. So for example, make sure everyone's involved, don't talk over people, treat everyone with respect, go in and introduce yourself, those kind of things. Like, they're looking for people who get along with other people, essentially. Is there any advantage of doing in-person versus online interview? Not necessarily, and unfortunately it is out of your hands. It will just be completely dependent on what the university tells you to do. How long do interviews typically last for? Very dependent on the university. Each one is different. You would have to kind of have a look at your university specific one. I had interviews starting from 20 minutes long. My King's interview was about 20 minutes long because we answered the questions pretty quick. I've also had MMIs where they were strict with timing. It was like an hour, the whole thing. What other unions did you apply and get offers to? So I personally applied back in COVID to St. George's, Leicester, Queen Mary and King's. I got King's and Queen Mary. Unfortunately, didn't get St. George's and Leicester. St. George's had a system where you had to record yourself and then send in the recordings of your interview answers. I am not a camera person when it comes to recording, so I will say it wasn't my best performance. And Leicester, I unfortunately had a role play which I wasn't prepared for, so didn't quite do so well on that. So do go ahead and practice your role plays, learn from me, get some experience, and definitely try some difficult role play scenarios. How are we expected to mention our own research specifically in these hot topics? You wouldn't mention your own research in hot topic. Hot topics are solely for the information that you need to know and your ethical topics. If you want to talk about yourself, it would be relevant to questions that are regarding tell me about yourself, tell me about your extracurriculars, so on and so forth. Should vaccines be mandatory? That's a great question, and I am going to leave that one for you to ethically debate and maybe bring back to the next webinar. Are dentistry interviews for uni very similar to medicine ones? Yes, very, very similar. The only thing is naturally the topics will be different to these NHS hot topics. Some of them will be similar, some of them will be not. Like, for example, the backlog thing is very much a dentistry issue as well. But naturally, for example, the BAME issue, very similar for dentistry. But for example, ambulances wouldn't be so relevant to dentistry. But I think there is definitely a few more things you should know, but I would go ahead and just search up dentistry hot topics. Will you be doing a session on Breaking Bad News? I will have to see. I don't know what our next one is about just yet, but if you tune into our next week's webinar, you'll find out. Also, any tips for online interviews specifically? Sounds like it could be a lot harder to get your personality across. Yeah, I think for online interviews, be the exact same. But one thing I recommend is kind of have your screen a little bit away. So for example, if I was to push it back here, just so you can see me a lot more. It's not like really close. If I'm up here, then you're not really getting to almost see me as a whole. I think kind of your positioning, personality, don't worry about that too much. It's more about the quality of what you're saying. Just be expressive and just be a normal self, and that should carry through. Okay. How do you recommend I start my interview prep? I think take it slow and steady. First of all, look at all the different categories. So for example, ethics, role play, communication, teamwork, so skills-based things, so on and so forth. Break down the categories, then go ahead and research all the different types of questions. There are some really good pages. If you just search up medical interview questions, it does it in the categories for you. Then take it category by category, and then just slowly, whether it be a question a day or just like a little mock thing with your family or something per week, that's all I recommend doing. For the question on staffing and problems that come with it, should I mention Brexit? You definitely can. Brexit was a very big impactor, and you're exactly right. So many nurses from Europe left due to contracts and discrimination. This created a gap. Never too political, because you know what? NHS is politics. Unfortunately, the doctors are the medical side, but the actual NHS structure, that is politics, that is government, that Brexit and all these things do impact that, sorry. So I definitely recommend mentioning those. Okay. Oh, you're most welcome. Are any of the questions based on research papers? No, you shouldn't get anything too specific like that, because that's unfair. But hypothetically, if you did get like a case or a scenario that you weren't familiar with, honesty is the best policy. Don't try and lie. They're going to clock you more for that. They love honest people. You can just be like, unfortunately, I'm not very aware of what the this case is about. Would you be able to tell me a little bit of information? I can try and discuss based on that. They love that. Is there any specific news source we can follow? Definitely recommend things like just BBC or the BMJ, so British Medical Journal. They're a really good place, really good people to kind of follow along with the news. You're very welcome, guys. Is there usually graph questions in MMIs? There might be if there's like a data interpretation question, but that's a whole station of its own, like data interpretation. Is there a certain age limit Gillick's competence applies to? Yeah, so 18 is when you become an adult. Gillick's competence for general medical stuff, not necessarily age limit, but naturally, if you're teaching towards like 5-year-olds, they're not really going to know enough to be able to have Gillick's competence. But for sexual health, it is 12 years old to 18, because under 12, any sexual intercourse or anything like that is statutory rape regardless. Is there a structure we can use for all or most ethics questions? Definitely the one I spoke about. So kind of explaining it's a complex issue, 1 or 2 facts, going ahead, pros and cons, giving your opinion or whatever your judgment is, but then going ahead and just putting like a nice cushioning statement at the end saying you will be exploring more and you will be looking into it more. What happens if the child with Gillick's competence agrees to a treatment but the parents refuse? Whose view takes priority? Depends on the treatment. If, for example, there are a 14-year-old who, say like Jehovah's Witnesses, don't allow blood transfusions. If the parents are like, they're putting their religious thing on the child, but the 14-year-old is like, I am fully aware of my consequences. I know what this means. I am fully competent. And they're like, because of that, I still want the blood transfusion. You take the child because they've got autonomy. It's their body they have right over. Do you have experience of Scottish interviews? Will they ask about situation in England? So I'm not too familiar with Scottish interviews, but I would recommend looking at Scottish specific things if it's for a Scottish interview. They might ask about NHS UK just because naturally we are part of like one big NHS system, but there are more Scottish specific things. Honesty is super important. Is it professional to mention in an interview that lying is good if it's to make someone more comfortable? How should I phrase it better? And that would be, so lying wouldn't be good to make someone comfortable. That would be going against honesty. But it's more about what I was mentioning about the concept. I think it was a consequentialism, and that's more about like the concept or the idea. So it's not the lying is just an example I gave. I don't recommend using that one, but it's more about the concept. So but if you find yourself questioning that concept and saying, well, that doesn't make sense, then don't use that in your argument because clearly you don't agree with it. So only use ethical concepts that you agree with. Is Gillick's competence only sexual health for under 18s? Gillick's competence is about all health, medical health for under 18s. Fraser's guidelines is for the sexual health aspect. UCAT exams. So for UCAT exams, I think UCAT exams, that is one that I would recommend. Don't worry about that now. Worry about it more close to the season. But we have some really great courses and things. So if you do want UCAT advice, I would say look at it closer to the time. We'll have some really good courses and presentations going on about those then. So same thing. So another person asked about being in year 12 and what they're focused on for entering medicine. Your focus should be like work experience, volunteering, just getting as much like kind of experience in reading articles, reading books, those kind of things. And of course, your education. That's the most important thing. Will the interviews... no, interviews should not judge your English levels. What is advisable for appearance? Appearance for interviews is very important. So as long as if you feel like you could walk into a London office with your attire and your hairstyle, you are okay. If you feel like you wouldn't fit into a high-end London office, maybe you have to look a little different. Keeping it smart, casual, like, the most casual I would go is like a 3/4 zip that's quite professional, but I would recommend like a button-up shirt. I think that's just stay safe, button-up shirt. Can do a tie, you don't have to do a tie. Make sure if you're online, you are dressed top to bottom. If you stand up in your interview and you're not dressed on the bottom appropriately, they will see it. So make sure you see that. Make sure you do that. Facial hair is fine, not an issue. Jewelry, just keep it minimal. Those are the kind of things I would recommend. How do we balance A-levels and interview prep? A-levels are the priority, but interview prep is more of a thing like you only do a little bit per day, maybe answering one question per day, maybe taking an hour on your Saturday to kind of just look through a topic or a category or a few things, doing one mock interview. Interview prep won't take as much time, but like I said, small and consistent is what is key. Do you recommend we make model answers and memorize them? Not memorize them because you don't want to sound robotic, but I think make model answers in bullet point formation so you can kind of review and remember information. Whose opinions prioritize, parent or child, if they have opposite views? So as I mentioned before, it depends on whether they fulfill the criteria of Gillick's competence. Do they understand? Is it in their best interest? So and so forth. then you would pick child because of autonomy. But once again, it depends on the situation. Everything's a little bit different. In a station on a hot topic, if the interviewer brings up a counter argument that you actually think is very good, happens to change your mind, you can be honest. Just tell them, that's a very good argument. Thank you for bringing that forward. I think that is something that I didn't consider, but it's definitely something to take on board now. I think I'll definitely have to look into that perspective. For outside of Oxford, you don't need any A-level knowledge for your interviews. You can bring your own work experience into ethical questions if it's relevant. Don't try and force it. You will have your own stations for work experience. Oh, what questions should you ask if they give the opportunity to show interest? You can go ahead and ask, depending on their role. If they're a medical, like, how do you find the university? Or if they're a professor, like, how do you find your role as a doctor? What specialty are you in? Something like that, if you want to. So I noticed today you didn't say or like at all. Thank you. But you spoke really fast, but clearly, which is amazing. Thank you. I do speak very fast. That is, you know what, now I'm going to be really hyper aware of it. I do know I speak quite fast. Sorry, guys. Hopefully you guys caught into everything I was saying. And now I've gone ahead and said, and I got again. So in terms of avoiding saying things like and like, I think so when I was doing my interviews, I was really bad. I would say every other sentence. It was really bad. But I had a teacher who clocked me so bad. What they did was they recorded my answer and then made me count the number of times I said like. And then and I was very hyper aware of it. So if you find yourself saying things like and like a lot, I would recommend just record yourself, count the number of times you say it, and make a note of it. And you have to keep recording yourself until you do better. But it does come with practice. I mean, in terms of these webinars, I've been very fortunate to work with the Medic Portal for a few years. I do a few of their courses. I've been doing this for a while. So thankfully, in that case, it's really helped in terms of my articulation. And I definitely wasn't as confident before this. And now I'm saying a lot because I'm hyper aware. Sorry about that. In that case, so what I would recommend is just the practice makes the perfect. Speak to different people. Do interview questions with teachers and then peers and then family and whoever you need to do it with. How can I stand out from interviews? This is a very good question. It's everyone wants to stand out. The main thing is be authentically yourself and be able to defend yourself no matter what you say. Make sure the quality of what you're saying is good rather than trying to be flashy with what you say. What would you recommend doing to remember what we've learned from reading articles or hot topics? I completely get the forgetting it after a while. Read things regularly, but what I like to do is keep a little notes page of all the things I learned and just read it maybe once a week just to kind of keep it on the top of your brain. For general interview prep, would you recommend making flashcards? If you want to. For general, for example, why medicine questions, I had a little paragraph that I kind of a little bit revised and remembered because you don't want to sound robotic. So if you want to make flashcards about some key facts, key topics, things like that, use it definitely. How many MMI stations are there at King's? Not too sure about the current King's structure, but when I was doing King's, they had a panel interview where they had MMI questions kind of back and forth. So it's about 4 or 5, I think, but I would definitely double check and just, if in doubt, check the website, ask King's themselves. If you want to study outside the UK, definitely recommend I'm personally not too experienced with outside of the UK, so I would recommend speaking to someone outside of the UK about preparing to study out there. For Breaking Bad News, how do you recommend approaching it? In terms of Breaking Bad News, I'm going to come back to that one if that's okay. What do I do if my mind goes blank or I'm uncertain? That's completely fine. It's a really nervous situation. Take a deep breath, take a second and just be like, I'm really sorry. I just need to take a second to recollect my thoughts. And remember your bullet points. In the interview, your brain is going to go blank very easily. Take 3 bullet points that you're going to remember, and that's what you need to focus on. For deciding between whether one person or another person gets an organ, for example, what factors should I consider? Definitely things like, as you mentioned, quality of life, immune system. Normally in the organ donation ones, they'll have a statement that goes, they all medically compatible. Think about what are your rules and conditions for organ donation. So for example, I would think about quality of life. I would think maybe about utilitarianism. This is where you can use justification for ethical concepts. Who's going to be helped the most? How are the most people going to be helped? I might think about who genuinely wants it. Like who, for example, in some organ donation ones, I've seen where there's normally one person who's had a paracetamol overdose and therefore they've had suicidal ideation. I might think to myself, is giving them this liver transplant the best thing? Is this what they want? So I might ask about who has the right autonomy. So make like a 2 or 3 point checklist of your key things to look for. Gap year students do not get disadvantaged. It depends on university. Majority don't, but I would double check. Some universities don't really accept gap year students as much, but some definitely do. Is there any type of ethics questions that may catch you off guard? Not necessarily ethics, but hot topics, yes. There was a very infamous one where in Brighton, I think it was Brighton and Sussex, you asked about climate change with medicine, which no one was prepared for. If you feel thrown off, take a deep breath, think general. Most ethics and NHS hot topics, you have points and things you can think about. You know about climate change, break it down to a few key points. How would you answer a question about a topic you aren't familiar with? Like I said, be open and honest, ask them for some information before you go forward. Practicing within the time limit provided, set a timer and go ahead and answer those questions to practice within the timer. If you talk for too long, the interviewer may stop you, yes. As a year 11 student, focus on GCSEs. I would only recommend focusing on like UCAT a few months before UCAT. Interviews like a month or two before interviews. That's the main thing. I did my introduction. If you did your EPQ and it does come with personal statement, I recommend anything you've written in your personal statement, reread your personal statement and re-memorize what books and stuff you've read before you go into your interview. You don't need to learn about all the roles and responsibilities of all members of the MDT, but it's good to know about quite a few of them. Oh, thank you so much. For the questions on organ donation and prioritization, could I bring up the principle of non-maleficence? I'm going to come back to Rebecca. So for the question of organ donation and prioritization, could I bring up the principle of non-maleficence? For example, by explaining that if I allow a drug-using patient not to receive liver transplant, I'm actively causing further harm, which aligns with non-maleficence. So this one, I'm very conscious that I'm now saying and like a lot more than I was before. It's because I've been made aware that I'm saying it. So in terms of that one, it's more about the justification. So let's have a look. You can definitely say something like that. I think you can also kind of battle it back and forth as well. I mean, you know, not doing a transplant for someone who has had a drug overdose, maybe, you know, thinking their best interest, but also if we know that, and they say specifically because paracetamol overdose is the example they gave, which does impact your liver, they would be more likely to need it, if anything, but a more of an imminent thing for them. So yeah, so we can't use age and stuff to discriminate. So think more along the lines of quality of life, utilitarianism. I would say think about what your rules and conditions are as well. Like how would you say organ donation is a priority in the sense of, for example, I might say something like, I would say for organ donation, I would say something like, let's have a think. I might think that for organ donation, I might go more with the utilitarianism approach, and maybe there's someone who's a sole carer for their father. So I might say that in giving the organ donation here, I've got 2 people I'm saving. So it is a bit of a harder one, but it is when you just kind of have to sit down and think about what would my 2 or 3 rules be. If you feel like you've said all the things you want to say, yeah, you can go ahead and say thank you. That's all I have to say. If it's a Scottish uni, you want to think more Scottish specific. Always narrate your thoughts in the ethics questions because they want to see how you're thinking. That's the point of the question. So why medicine and tell me about yourself are very common interview questions that you may hear a lot of. It depends on the interview, but sometimes you might be the only one talking for the 5 minutes. Sometimes I'll have follow-up questions. Sometimes it'll be a conversation. It really depends on the interview. When discussing topics that contradict your faith, will it be frowned upon if your reasoning is based off of that? Not so much frowned upon, but definitely something to be careful of, because if you allow your faith to interfere with your medical work, is that you looking out for the best interest of the patient, or is that you looking out for the best interest of yourself? Is something they may ask, something they may come back to. Do I need to approach online in-person interviews differently? Not necessarily, it's just the format. I think keep the same energy to in-person and online. If I had to choose between in-person or online, I would choose in-person solely because I like being in person and talking in person. So I think that's just more of a me thing. Is there a specific list of jobs universities will ask for? Why medicine not? If not, would you say there is quite a complex? I would say look up all. I would say look up, like, just Google something like I'm saying like so often now. I would recommend Googling something along the lines of medical interview questions, and you'll see a vast range. It could really be anything and everything. If they ask you about what medical news have you read upon, can you bring up the hot topics you've researched? Definitely you can, but if they're asking you about medical news recently, you would more likely want to bring up something that's been in the news more recently. How do I know where to stop when researching hot topics? As long as you've got the main, I think stick to the Medic Portal website and then look at recent news. Do you enjoy medical school? I love medical school. I think it's definitely a journey, but medical school is one of those tough things, but you definitely get such amazing experiences. You take it with a pinch of salt, but it's definitely such a great experience. Was there a specific reason you chose King's over Queen Mary? I really like King's structure. So King's is very clinical, and I really like the location of King's as well. So I quite liked the idea of King's being clinical from second year, and only first year was very heavy lecture based. After that, it wasn't at all. So I really enjoyed that structure for King's. So that's why I chose King's over Queen Mary. Do you do a webinar each Thursday, and how would I find how to register? I would have an email in, but we have a Thursday webinar. It was last week, this week, and next week. I'm not sure if we have any more after that. How would I apply for the next Zoom session? Also, TMP host, how do people apply for the next webinar? I'm not too sure on the guidelines there. If you were there. I'm not sure if they can hear me, but we will come back to that. Pop an email. There should be a way to sign for the webinar, or look on the Medic Portal website, I would recommend.
Hi, yeah, sorry, I'm trying to answer that myself, but yes, Finishing's right.
Well, hopefully we'll hear a response in a little bit, but if not, just pop in an email. So Brexit, I can give you a quick snippet of what Brexit was, but I recommend reading up on it. But Brexit, in a nutshell, is something that a lot of British people, to be fair, don't understand. But in a nutshell, we left the European Union, which was kind of a bunch of countries put together. And when we left that, we kind of stopped having a few deals, and it meant that there was certain restrictions. So, for example, when we go through passport control, we wouldn't go with the European line. We have our own, like, we have to go for the non-European line. So it's a little bit complex to explain, but I think have a look into it. But in a nutshell, we left the union, which means that we lost a lot of the perks. That means that we didn't have to give things to these other countries, but we also didn't get these things that you would get if you were together. So we're in a union, you all help each other out. England left that, so Britain left that in a nutshell. If you need time to think, definitely take it. Role play is a little bit different because as soon as you enter the role play, it's kind of you're kind of set in stone, the actor started. So unfortunately in role play, you don't get time to think, but you would take it as though you're speaking to the actor. So you might say, unfortunately, I'm really devastated by what's happened. Would you be able to give me a minute so I can consider some more solutions? But you'd be speaking to the actor within the scene. You're very welcome, guys. Day before your interview, relax. You're not going to cram anything that's going to be new. In preparation for the interview, you've done all the work you can. Day before, relax. And the best advice and the most important thing I say to all my students, you earned your spot to be there. They've asked you guys for an interview to come. If you didn't deserve to be there, they wouldn't have asked you. Simple as that. Lying should never be okay in medicine. It's unfortunately just the example I gave. Thank you so much for the thank you messages, guys. They're very sweet. If I have a biomedical degree, you can use that to your advantage in terms of the skills you learn. So maybe the ability to write research papers, things like that. What do I do if there's an awkward silence in the panel interview? I think there normally isn't an awkward silence in the panel interview. They'll ask you a follow-up question. But if you feel like there's an awkward silence, you can say something like, you can think of maybe more points you want to add, or you might say something like, thank you so much for the question. Would it be okay if we move on to the next question? Something like that. If you would like to look into some mock interviews or tutoring on myself, you're very welcome to sign up on the website. We offer those. So if you just put in my name, you're very welcome to work with me. I'd love to work with you guys. Would bias factor into answering prioritization questions if someone has a relative that's dependent on them? It's not supposed to, but it's all about the way you justify yourself. Because if someone has someone dependent on them, normally you're not supposed to give them priority. But I might say that it's a utilitarianism approach, and I'm therefore helping two people. So as long as you can justify yourself, there is no right or wrong answer. Is it good or bad to mention what specialty you're interested in? Not at all. I mean, if you have an idea of what specialty you're interested in, it's always very interesting, as long as you can say why. Oh, thank you so much, you guys, for your thank yous. They're very sweet. And my name was Panusha, so that's Panusha. About blood transfusion. What if the child refuses the blood transplant, but you suspect that the child has been coerced by the parents? If you find that that's a little bit complex, you won't get something so complex in the interview. But if you feel like the child has been coerced, I would say something like, go ahead and have a conversation with the child in private, or maybe remember your role. You're a doctor, not a detective. If you feel like there's been misconduct or abuse, go ahead and report it to the relevant authorities. How did you revise like Word documents or flashcards? I had a little document because I have short-term memory, unfortunately, so I forget all the fun facts I learned. So I had a little document I like to write, but I always did like little mock interviews with my friends. I made my poor parents sit there and answer me questions on a regular basis, and I recorded myself because the biggest thing was I wasn't aware of how I looked, and since that teacher pointed out the number of times I said certain words, I made sure to record myself and look at myself when I was talking about it. You're most welcome, guys. Thank you so much for the sweet thank you messages. Let's have a look. For the interview involving teamwork, how can I show that I'm a good team player? Have examples. So think about things in your personal life and give specific examples. So maybe you're on a sports team and one time there was a tournament that you guys were playing in, but you were a very good team player because you were motivating and you were supportive and it came out with a good output. So best way to demonstrate you have any skill set is to always relate it back to a personal situation. If you get an interview, doesn't mean that I have a high chance of being accepted. It's definitely one step closer. They were interested in you enough to give you an interview. So it does mean you have a good chance, but it always depends on how you do on the interview day. For organ donation, could we say if one of the patients is a heavy smoker? You might say something along the lines of, if they're a heavy smoker, they wouldn't really fulfill the guidelines, and in that case, you might give them less priority. You're very welcome, guys. Very sweet thank you messages. Do you know any tips for Southampton? Not specifically Southampton, but if you would like to know Southampton, one thing I recommend is if you have any specific universities that you guys want to know about, go ahead and message the people at the universities. There is a med influencer in every university, I can assure you that much. Go ahead and message them, DM them, speak to the universities. That's always the best way. Body language, definitely keep eye contact. Treat it as though you're speaking to someone in real life, whether it be online or in person. Eye contact, body language, keep it conversational. You want to keep it professional but conversational. They are people at the end of the day. You're most welcome, guys. For group interview, should we avoid taking the writing role? Not at all. Role delegation is not a bad thing, as long as you continue to be involved. The why medicine stuff, can the why medicine question and stuff sound really similar to personal statement? It can do, because your personal statement was based off of that. How do I approach data or calculation practice questions? I would recommend look online and look up. There's some really good videos. They're very kind of generic, but they have some good guidelines. So I would recommend watching some YouTube videos on those. Can I contact the university if I have a question to ask? 100% you can. No harm in trying ever. Let's go back to the top. So once again, for Southampton graduate entry, I would recommend speaking to someone from Southampton. For Breaking Bad News roleplay, how would you recommend approaching it? Is there a format you can recommend? I would say for Breaking Bad News, I think I spoke about this last webinar. If you can, try and get a hold of the webinar from last week. I think we spoke about it then. How do you answer what's the difference between nurse and doctor? Think about their job roles. I would say have a Google and see what are the literal differences in the job roles, and think about what relates to you. try to avoid saying things like, I would rather be a doctor, but say things like, I'm more suited to the role of a doctor. But then you have to justify it. What is it that a doctor does different to a nurse? And what skill set do they have that you then have so you can then become a doctor? For graph and reading, I definitely recommend having a look online, guys. There's some really good pages. If the child refuses the blood transfusion, they confess that we spoke about this. In terms of UCAT scores, it really depends on each universities. Have a look at what their guidelines and cutoff are. Would it be good, bad, or irrelevant if we mentioned that we learnt or heard of a similar scenario to a station during UCAT prep? You can definitely mention it, but it doesn't really add value to the question as such. It's a bit just kind of a waste of a sentence, if anything. As a hijabi who wears an abaya, would that be appropriate? Of course, if it's something that's to do with religious reasons, 100%. As long as you're not wearing like a bright pink abaya, that might be a little bit less professional. If you're wearing, you know, professional office colors, completely fine, not a worry at all. Oh, you saw me at school yesterday. Yes, I was at school yesterday. Hello to the person that I saw yesterday. You're most welcome, guys. In my work experience in the GP, I saw a patient signing a power of attorney. Could I bring that up with autonomy? 100%, because with people who don't really get a chance to speak about, who put something in place for their future care when they can't make decisions, that is part of autonomy. You used your right to decide what's going to happen to your body, and you gave that right to someone. So that is part of your right. What levels of A level would you recommend go for? You won't need any, unless you're doing Oxbridge, you don't need to go over any A level content for interviews. Would you? If you're trying to decide what to do for your fifth choice, but you know you only see yourself doing medicine, think of things that may be a pathway to medicine. Biomed seems to be the classic choice, but biomed's not the most fun thing in the world. I mean, I personally wouldn't have enjoyed something like biomed, but you could do pharmacy and then go into medicine. You could do genetics and go into medicine. So think about the aspects of medicine that interest you and what other career paths have those aspects so that you can do a degree that you enjoy if by chance you have to do a fifth choice. When did you receive your interview invitations? I've received mine kind of varied. I think it was across November, December, but my friends who had the exact same portfolio as me received it in very varying times. Unfortunately, I don't know too much about Southampton, so I definitely recommend having a look online. For each of the answers, the length of the answer is really dependent on the interview that you're going to. You don't need to reply straight away to an answer a question they ask you. You can take a second to breathe and just be like, I'm going to take a second before I answer this question. For your EPQ, write it on whatever you like. The EPQ is normally to look at the skill set you've learned, like your research abilities, what skills you developed, not the actual EPQ itself. So whatever your EPQ content is on, it's 100% up to you. Are there any answers to why medicine questions are frowned upon? If it's things like, oh, I just like helping people, but you aren't able to back yourself, you don't talk about work experience, those are things that aren't so favored. You're most welcome, guys. Does medical students have time for clubs and those sort of things? 100%. It depends on the work-life balance you guys choose. But I think as long as you make that a priority, there's always time and space for whatever you guys like to do in medical school. It's more about what do you prioritize. Life in medical school doesn't have to be, I always have to do medicine. There is so much time for other things. It's just about making sure you realize that you're a person outside of medicine. You are also so important outside of medicine. Being a doctor is not your life. You are your own life. So whatever you choose to do, make sure that you're able to find that balance. It's a journey to find that balance, but it's very doable. What email should I ask regarding Breaking Bad News? If you email and ask for the recording of last week's webinar, you may be able to find it. Backup choice pharmacy. For your interviews, for what personal statement to get a pharmacy interview, that one I think you'd have to, since I personally don't have any experience, I don't want to give you advice that's not too strong or too sure. I would definitely recommend having a look because I'm not 100% sure in that category, unfortunately. You're most welcome. Oh, another person I saw at school yesterday. Very nice to see you guys. Would I look professional if I wore an Elvis Presley suit to lighten the mood? I unfortunately don't think an Elvis Presley suit will get you through the interview. As much as I'm sure it's an amazing suit and it sounds incredible, but I would say maybe a little bit more of a boring suit. But hopefully your personality brightens up the exam, and I'm sure it definitely will. Going to London Uni, do you commute? Do you find it difficult making friends? I didn't commute for London Uni, so I chose to live out. I was very fortunate to be in a position where I could live out, but that's just something I want to do. It's not difficult to make friends as long as you try talking to as many people as you can. It's very, very worthwhile. London University, the experience is absolutely incredible. I highly recommend it. We have so many sites. Just make sure you get involved in order to meet people. How did you manage the nerves during interviews? I'll be honest, I didn't manage them that well. But it's just remembering that, no matter what happens, what's done is done. If you truly want medicine, you will find a way. And you're most welcome, guys. So I think that brings me to the end of all the questions. I know I've kept you quite a long time, and quite a few of you have stayed quite a long time over. So thank you so much for bearing with me. It's been an absolute pleasure talking to you guys. Such amazing questions. It's been a great webinar. I hope to see as many of you guys next week. So I hope you guys have a great night. Thank you so much. And I'm going to hand it over to my fellow colleague. Is it all good for us to pop up there?
Yeah, definitely. Thank you all so much. And thank you, Prushka, you've been amazing. Thank you. This was meant to finish 40 minutes ago, so you have gone completely out of your way to support all the students. So well done. And hopefully people will join the Medic Portal and you'll be their tutor.
Oh,
that'd be amazing. Have a lovely evening, everyone. Thank you. Bye.